question number 2, and we start with Jessica this time. What is the position of your party on the role of for-profit healthcare? In particular, does it make a difference to your party whether healthcare is provided by not-for-profit healthcare services versus for-profit healthcare services? What specific measures are you prepared to take to stop the rise of for-profit healthcare? You have 2 minutes.
Okay, thank you. In the past year, the wait lists have reduced in Nova Scotia for orthopedic surgery because of the contract with Nova Scotia Surgery Inc., which were able to do the same surgeries that are done at a publicly funded hospital, and they were still publicly funded, reducing the wait times for elective surgeries. I'm not opposed to for-profit healthcare. I think that there should be room in a public system for innovation. And if the same service is available by a private provider, so long, the main thing being that when you show up for your procedure, be it cataract removal or orthopedic surgery, that you pay with your Nova Scotia MSI card. That's the main point. Whether it's done at a for-profit facility or a private, I think it is unrealistic to limit healthcare to one version of provision. At the end of the day, if the service is just as good, and you're getting a cataract surgery done at a laser rod clinic, you know, Laser whatever Inc., does it really matter? If the government is able to pay for that, shorten the wait times and get you in and out of there quicker. I would hope that that's the end result that we're actually looking for, not the mechanics of whether something is completely publicly funded or whether there's a profit involved. If a company can do something as good or better as a public system, I think we need to have the innovation and the foresight to be okay with that.
Howard?
Thanks very much. If there's a clear issue on which the difference in perspective between the NDP and the Progressive Conservatives provincially and of course nationally comes across, it's really with respect to healthcare and the issue of privatization. We have to start by recognizing that of course many aspects of our healthcare system are already in private hands. Pharmaceuticals, for example, of course, are private pharmaceutical companies, are private, pharmacies are private. Doctors, in some sense, most doctors are not employed by the healthcare system. In some sense, they're sort of private actors, although they're paid by the public system. That's not the point. The point is to resist further privatization of the system. And there are perfectly good reasons for which the representative of the PC party was oblivious. And the main reason is that healthcare is expensive and there's not enough of it to go around. And if you privatize it, you're introducing a system that has a profit motive built into it, which means it's costlier. And it also competes with the public system. And furthermore, hospitals that are private hospitals in the United States have been shown through various studies not to produce as good results in terms of the health outcomes for the patients. So there's a whole range of reasons that why we ought to continue to protect our public healthcare system to the extent that it is public already, recognizing that there have already been significant private elements in it already. If the question is, do you go any further with that? And our answer is, you don't.
Andy.
This question is a red herring. The question is framed in terms of who owns the provision of services. That's irrelevant. What is important, what's absolutely of cardinal importance is who pays for services. You know, we Liberals founded this system and we've maintained it in Canada, that there's going to be one payer, the Government of Canada, and as it works out, provincial governments with assistance from the Government of Canada. What we have to make sure is that, and we cannot waver on this, there cannot be private patient payment for health services. Who provides those services? Howard says that private hospitals are inefficient. Well, what the government does is it pays for services. If you have a broken arm, you go to a private or owned or public service, you get paid the same amount. If the private facility is inefficient, then it won't continue. That's a red herring. The threat to our healthcare service is in allowing private payment. And we should be adamant and vigilant not to let that happen, and not get sidetracked with red herrings about who owns the facility.
Jessica, you have 30 seconds to respond.
I agree with you. I agree with you 100% on that, Kenzie. I do agree that American hospitals are not more efficient just because they're in private hands, because the hospital becomes a business, and every test that can be done will be done because the hospital has a right to provide it, of course, at a profit. I'm not a fan of for-profit hospitals, but the question was for-profit healthcare. And I think most of us who have ever tried to run a small business would know we can make a buck stretch farther. So just because there's a profit motive involved, it can increase productivity, because anything that is public is not often as, not necessarily as well run as a private institution. There's innovations that they can do that.
Okay, your 30 seconds.
That's all right.
Pass.